Good afternoon, welcome again to my channel. My name is Taiwan. Today I'm just going to be shedding a bit more light on hypertension, because I know a lot of people, they're not really, especially with women, when we're busy. It's not only for women, but women, I've seen a lot of issues about women who don't check their blood pressure, and some women have died because they don't know that they have high blood pressure, and they've just been working hard and working back to back. Just a bit of facts. It says that about 1.28 billion people of adults aged between 30 to 79 have hypertension, and about 46% of people do not know that they have it, because sometimes you don't get any symptoms. It's very rare to see the symptoms. It gets to a very high level of the reading before you start to feel the effects. But you can easily detect it if you start having a little bit of symptoms, which I'll describe here in a minute. So the normal reading for diastolic and for systolic and diastolic pressure is 120 or less or lower, and the diastolic, it should be less than or equal to 80. If it begins to get higher than that, that's the pressure is building up, and it doesn't mean you have high blood hypertension, but the way just to know that that's the normal level, that the measurement. So the risk factors are family history, age, alcohol consumption, obesity. When you have when you're overweight people have increased risk of developing hypertension. Smoking, consuming too much salt, high salt intake, and generally, if you don't do exercises, your blood pressure like once every year, and if you have high risk factor between the ages of 18 to 49, you do it once every year. After that, you can do it. You just have a blood pressure machine in your house and just check it regularly. I'll talk about the causes. Some of the causes, some of the things that can cause it is over-the-counter medication, like when you buy painkillers, things like when you get maybe birth controls. Some birth controls, is said that it can cause it. On my list here, I have got people who have other, underlying health issues, health problems. I've said too much salt intake. If people have kidney diseases, can cause it. And if you're stressed, if you're usually stressed, and if you don't drink water, it's good to have a lot of intake of water regularly, so that you don't suffer from dehydration as well. And then the symptoms, this is very important. When you find that you're beginning to have the symptoms, is rare and it's really hard to know. It usually shows when it's become very high, when the level has gone very high. But some of the symptoms that you can watch out for are shortness of breath, blurry vision, if you have heart palpitations, headaches, and nosebleeds. Those are the kind of symptoms you look out for. If you start having like maybe headaches, constant headaches, heart palpitations, or maybe for no reason, you just have having the heart palpitating, and then it's better you go and check yourself quickly. Because if it's untreated, there's risk of heart attack, stroke, and other health conditions can arise from it. So now I will talk about treatments. There are different types of treatments. If you are diagnosed of this, there's a treatment plan that they put people on to help regulate the blood pressure from time to time. But it's very important. If you have been diagnosed of high blood pressure, you just keep checking yourself from time to time. Living a healthy lifestyle that can help reduce the risk of high blood pressure, hypertension, such as having regular exercises or being active, being all the time. You try to be active, having good sleep, because lack of sleep too can cause it. Sleep apnea, people suffer from sleep apnea, can cause it. So try to rest and have good sleep, eat healthy diet, consume less salt, just minimum amount of salt would help. And what else do I have in here? You can prevent it by not smoking or excessive drinking. Excessive drinking can cause high blood pressure. Too much alcohol can cause it. Thank you for watching. I hope this has helped you or someone, and see you in my next video. Remember to subscribe and like, and put your comments in there. Thank you very much.